Lassa fever is a viral hemorrhagic illness first discovered in 1969 in the town of Lassa, Nigeria, where it caused a major outbreak. This disease is endemic to West Africa, and it's estimated that between 100,000 and 300,000 infections occur annually, resulting in approximately 5,000 deaths. Lassa fever is caused by the Lassa virus, a member of the Arenaviridae family. The primary reservoir for the virus is a rodent called the multimammate rat. These rats are common in West Africa and can spread the virus through their urine and feces, contaminating food, water, and household items. Humans can contract Lassa fever when they come into contact with these contaminated sources. Human-to-human transmission is also possible, especially in healthcare settings through direct contact with infected bodily fluids. Symptoms of Lassa fever typically begin 1 to 3 weeks after exposure. For many, the illness may present mildly or even asymptomatically, which can make it hard to diagnose early. In cases where symptoms do develop, they often start with fever, fatigue, headache, and general malaise. As the illness progresses, more severe symptoms may appear, such as vomiting, diarrhea, facial swelling, and internal bleeding. In severe cases, Lassa fever can affect multiple organs and cause lasting complications such as hearing loss, which occurs in about 1/3 of survivors. Globally, Lassa fever is mainly concentrated in West Africa, with the highest burden in countries like Nigeria, Sierra Leone, Liberia, and Guinea. Though the disease has occasionally been reported in other parts of the world, such as Europe or the Americas, these cases are typically related to travelers who had visited endemic areas. Given the high population density and rural farming practices in parts of West Africa, where humans and rodents often live in close proximity, the virus continues to spread. The global ratio of Lassa fever cases has remained relatively steady, with most outbreaks localized within West Africa. However, the true burden of the disease may be underreported due to the mild or asymptomatic nature of many cases and the lack of widespread diagnostic capabilities in affected regions. When it comes to treatment, early intervention is critical. The antiviral drug ribavirin has been shown to be effective in treating Lassa fever, especially when administered early in the course of the illness. Treatment is primarily supportive, focusing on maintaining hydration, managing symptoms, and monitoring for complications. In severe cases, hospitalization may be necessary to provide intensive care, including dialysis for kidney failure and other life-saving interventions. Currently, there is no vaccine for Lassa fever, although several are in development. Prevention strategies focus on reducing human contact with the virus-carrying rats. This includes promoting good food storage practices, avoiding exposure to rat habitats, and improving hygiene. In healthcare settings, strict infection control measures are crucial to prevent human-to-human transmission. While Lassa fever can be a serious and sometimes deadly illness, it's important to note that the majority of infections are either mild or asymptomatic. With the right treatment, most patients recover fully, though it's essential to raise awareness and improve diagnostic capabilities to reduce the spread and impact of the virus. In summary, Lassa fever remains a significant public health challenge in West Africa, but with increased surveillance, early treatment, and ongoing research into vaccines, the global health community continues to make strides in controlling the disease.
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.